Morning, everybody, and welcome to the EGP Learning Podcast with myself, Andy and Gandhi,
and Dr. Andy Foster here as well. Good morning.
How's everybody doing? And thank you for joining us today as we're talking about our EGP Learning Podcast Digital Primary Care Update, and we've got a doozy for you. In fact, this is hot off the press. Happened this morning. We're talking about the NHS Covid app. So many of you probably heard about this, seen about this in the recent news. It got released just a few days ago, and already there's controversy. And we're going to be talking about that, showing you how the app works, how to sign up, basically everything you need to know about it as far as we can establish. And in addition, we'll be talking about our Digital Primary Care Conference, which is this Wednesday. So that's the 30th of September from 9:30, the doors open, but it starts officially at 10 till 3. And we've got amazing content, including Nikki Kanani giving her basically address about digital primary care and how that's going to work in general practice moving forward. Dr. Min Al-Bakai talking about digital first primary care, and a discussion with various providers and the BMA talking about how it's working at the moment, as well as loads of other content, including the digital journey planner released by Redmore Health, helping your practice, your network, your area, basically figure out this whole digital journey, including things like literacy aspects for patients, how to engage practice more effectively, and basically making that whole process a lot easier. On top of NHSX, Health Education England, various other sponsors and providers talking about their products to help your area, and some fun and games as well. So me and Andy are going to try and make this as enjoyable as possible for all of you. And if you do want to join us, make sure you sign up. We're going to talk a little bit more about it in detail a little bit later on. I'm just going to try and bring the link up. There we go. And if you want to join us, just sign up at bit.ly/digitalpc20, case sensitive, as you can see there, and you'll get your tickets, and make sure you join us for all this and more on Wednesday. However, let's talk more about this amazing app, if we want to talk about it that way. What are you thinking, Andy?
Yeah, so do you want to hand the screen share over to me? Let's bring some stuff up on screen and start to look through. So hot off the presses, so tail end of the week, the NHS has launched the NHS COVID-19 app. So it's the long-awaited COVID-19 contact tracing app. Some other countries around the world have had these for a while. It's a little bit debatable how impactful they have been on their fight against COVID-19, and we'll talk a little bit more about that later. But we now, after a long wait and a bit of a false start, have our own app in the UK. So we've got the article from the Metro here, which just sort of demonstrates the splash that the NHS has been making with this across media. And look at all these adverts. So there is an advertising campaign going along with the app as well. So all really exciting. So I signed in this morning actually to the app, and I took a video of the process and did a little bit of a video tour. So I'll just sort of narrate us through that. Does that sound sensible, Gandhi?
That sounds awesome. And I'll be chipping in. I actually downloaded the app a couple of days ago, and I'll tell you what's happened since then afterwards.
So we'll pause and skip through. So we've got a bit of opportunity to talk to some of the points if you like. So this is me logging in. So actually I found it a very easy, simple process. Actually, I think most people will find it pretty simple to get through. So they're addressing our privacy concerns up front here, and just giving a bit of a brief overview about how the app works and how it handles your data. So I read that, and then I clicked agree. Skip along. I clicked actually read more. So it links through to the NHS app webpage on gov.uk and gives all sort of information about how the app works, and also just some general information about how to use the app effectively as well. Lots, very long though, as you can see. So let's skip back. So I'm not a speed reader. I didn't necessarily read through all of those details. And I click yes. So here it is asking for the postcode. So this is interesting. So I wasn't aware it was going to ask for what I would consider personal data, but it asks for the postcode. My understanding is that it just keeps this stored on the device and it's not transmitted anywhere. The NHS England will broadcast periodically updates that come out to all mobile phones that give information about how high risk certain areas and postcodes are. And if your postcode is one of those areas and you've activated alerts on the app, then it will alert you that the risk level has changed and gone up in your area, and the risk level is visible within the app. Interestingly, and Gandhi pointed this out to me this morning, he went to London and tried to change his postcode to London and was not able to figure out how to change the postcode. So that's a potential flaw and potentially problematic for those people who don't spend all of their time living and working in one postcode.
Well, as far as I can tell, it doesn't allow you to do that at all. So unless you actually delete your data from the app and then relog back in, that's the only way to actually change your physical location in terms of that information as to your local area, how much of a risk you're at in that postcode. So yeah, definitely a bit of a flaw as far as we can tell.
Yeah, and obviously resetting the app defeats the object, because the important thing is the information it's logged in terms of your contact over the last 14 days. So this is a key bit here. So you have to enable exposure logging and notifications. And this is the part that Google and Apple have provided. So this links into the API, applications protocol interface within the operating system that does all of the clever Bluetooth transmission and receiving and logging of contacts. So you have to obviously enable that.
Important to note, there are only certain phones where that works. I believe for the iPhone, it's iPhone 6S or later. I mean, that was released in 2015. But if you have phones prior to that from Apple in particular, it may not work effectively. I'm not quite sure the Android level that you need in order for it to work, but there will be an element of it. You have to have a relatively, not new, but recent phone for this to work.
Yeah, and again, not confirmed, but I believe I've heard that there are some issues with some of the Huawei phones as well, although don't hold me to that. So great. Okay, you'll know where I live now, but it's a medium risk area, so that's fine. And then you can click through for more information about that feature, which is obviously what I've done there. So where you click for more information, it generally hands you off to the browser, and you can view information on the web page. So venue check-in. So all venues of a certain type, bars, restaurants, hair salons, those sorts of places where you are likely to sit and be present for a period of time while receiving a service, not just in and out venues, are going to be required to display a QR code, which people using the NHS app can log into. So you give it permission to use your camera. You just get to see a bit of my floor here in a second. But if you were in a venue, you'd show that, you'd put the QR code within the view screen and it would log your venue. And then, of course, if there is an outbreak or there is a case connected with that venue within 14 days of you logging your presence, you will be notified about that and asked to self-isolate. There's a symptom checker. I was a little bit scared to fill this in because I thought maybe it would tell me to self-isolate.
Yeah.
So I just viewed that. And then we can read about the latest advice. So that just goes through to, again, .gov website and allows you to link through to their advice, which I think is actually quite good and structured quite well about COVID-19. This is a little bit of information about this app. We'll talk more about how the app works and how it protects your data in a few minutes, but you can link through to data, again, on the NHS website about that. And what's next? Oh, enter a test result. So we'll save the controversy for a little while. But if you have a COVID-19, so if you have symptoms, the rules are that you would self-isolate, you would seek a COVID-19 test. Then you get your COVID-19 test results back. It can be positive or negative. If you get a positive result, then you should be provided with a relevant code, and you can click on the enter test result button and you enter your code in, and then those people who've had contacts with you logged by the app are notified of that and also asked to self-isolate. So that's really the key feature of the app, the most important thing, one would say. The last bit is actually a useful little toggle. So I just clicked on that toggle at the bottom, which was contact tracing active, yes or no. And you can actually turn off the contact tracing for a period of time, for 12 hours, which I think is a useful feature. And particularly, we'll talk later about what GPs are perhaps planning to do if they're registered with the app and they're in clinic and doing various activities, whether they'll keep it active or switch it off for those. So we'll talk about that later. And that's essentially the end of the app. So we've got to the bottom. So I found it quite nice, simple, easy to use, didn't glitch or experience any bugs while I was doing it. And that's the app. So download, have a play, have a look at it yourselves. So what should we talk about next, Gandhi?
Well, so there has been a little bit of controversy about the app, hasn't there? I mean, when it first originally came out, there was this whole question of which app the NHS test and trace mechanism was going to go through, and which the government were keen to procure, shall we say. And obviously this balance between all the elements of private versus NHS based and all this kind of stuff that happened. And then originally the UK was going to develop its own app, and then it realized that it didn't have the ability to do that. So then, like many other countries, it's using Apple and Google's architecture to provide the Bluetooth access. But it has gone and still created its own kind of version for the NHS, which actually, as we've seen, is quite good. It's simple to use, and it's relatively easy to use as well. And I do like the simplicity of that. Well,
absolutely.
There's been a bit of controversy over the past couple of days with this. So two parts. Number one, the whole concept of isolation. So Matt Hancock came out on public and kind of said that isolation was optional, I think 2 days ago. So if you get a notification that you may have had contact, that it was actually optional. And unfortunately, it didn't go into great detail as to what on earth that meant, but that seems to be a complete contradiction to all the other advice we seem to be getting.
We have to use our common sense, I suppose.
Yeah,
these
exactly.
are things the government always tends to fall back on those sorts of.
Like they're trying to devolve themselves of any responsibility. That's my perspective on that. But
yes, yeah, important not to get too political, I guess. But I think with things like this, which are complex, where people don't know what to do or how to behave, I think that clarity is really, really important. So it's unfortunate that we tend to get mixed messages, and that's a bit of creative criticism, I think, for the government, that actually clarity and simplicity would enable people to make the judgment of what to do a lot more effectively, I think. Gandhi, I'm really excited about this, about the technology behind this, because I think Google and Apple did something really clever, and it's conveying it and talking about it's quite difficult. But the FT a few months ago actually provided quite, if you share the screen, in one of the FT articles, they provided a diagram which helps you explain how it works. But I think it's really clever because some of the very early contact tracing apps, say in Korea and some of the Far Eastern countries, there were privacy concerns because, I mean, they have different traditions and cultures there that perhaps people would say perhaps value the greater good, the collective good, over individual sort of individual freedoms and individuality, which maybe has more of an emphasis in the West. We can discuss that at length, and I'm sure people do. But they actually collected quite a lot of personal data, sort of GPS locations and times, and who people were in contact with in a way that perhaps it could be visible to people within the government and so forth. And they had a more centralized approach, but they got things out there pretty early with their apps. There was a concern that those sorts of apps would not get traction in other countries and other parts of the world because the way that people think about privacy in places like, say Europe and the UK. So Google and Apple came together, which I think is great because they're far and away the two largest mobile phone platform providers, and came up with quite a tidy way that these apps work. So when the app is active on your telephone, it constantly or periodically broadcasts it uses the Bluetooth, and it broadcasts a sort of a cipher, a code, which is then logged by other phones that have been within close proximity for a certain period of time with your telephone. And that log of the codes identifying phones that your phone has been identified, that your phone has been in contact with, stays on your phone. It doesn't go anywhere else. It doesn't need to go anywhere else. It stays on your phone. Then if one of those people that your phone has been in contact with gets a positive result and they enter that into the app, then it broadcasts its unique identifier to all the other phones on the network, all the other phones in that country that are using the app. And then your phone checks the codes that it gets periodically through with its log of who it's been in contact with in the last 14 days. And if there's a match, then it notifies you that you have been at risk and that you need to self-isolate and get a test. And the really clever thing I think about this is that actually there is no need for a centralized store of the information. All of the information necessary for this to function is dispersed collectively across everybody's phone within that country, and I found that really quite clever. And actually understanding that that's how it works has given me a bit more reassurance to use the app, potentially. We'll talk about that later. But certainly to recommend the app to other people, because I feel quite confident about the approach that Google and Apple have taken to privacy. Another interesting point is, why do I trust Google and Apple with these systems more than my own government? I don't know. We can perhaps talk about that in some way as well.
Part of it, isn't it, Andy? That a lot of the use of this app is going to come down to trust, and that's the part I think is we're struggling a little bit with. What's currently been happening, and we're going to talk, as you said, about some of the developments that have happened just today that enhance this potentially a little bit more.
So Gandhi, let's do that now. But so the key thing, the key feature of this app is that if I get a positive test, so if I go and if I have symptoms, I go and get myself a test, and if I have a positive test, then I get a code, don't I? And I enter that code into my phone. And that allows my phone to broadcast to all the other phones on the network that I've been at risk. And if they've been in contact with me, my phone, then they should self-isolate as well. That's the key cornerstone feature. Absolutely. So what could possibly go wrong with that, Gandhi?
Well, do you want to stick it on the screen? So as of this morning, there's been basically a confirmation from the NHS app Twitter account that shows that they don't seem to link with the NHS database of test results effectively. Somebody's asked this question that they can't seem to put in a code to say that they've had a positive test, and the NHS app team on Twitter seems to have confirmed that it doesn't link with the NHS database of whether you've had a positive or negative test. So it only works if you've had those tests done through private companies providing that service to the healthcare system at this moment in time. And that's a bit of a problem, clearly.
Yeah, I mean, that's really dreadful. And we were talking about this before we went on air, weren't we, Gandhi? As to how is it come out without that feature? That is the absolute key feature. It's going to be such a public relations disaster for the app at a time when they're going to, when we really need to push people to download and use the app. On day 3 that it emerges that the core functionality is compromised because it doesn't link with NHS systems where the vast majority of people will be having their tests. It seems ridiculous. How did people not anticipate this and fix it beforehand?
That's the question, isn't it? It raises absolute questions about why this functionality isn't there, why it's being considered that this isn't an issue even for some reason. It may come out that this is false information, that the people running the app, the Twitter account, have actually given incorrect information. But either way, if that's the case, they should have known what they're saying. This is a potential PR nightmare for the app. And you're right, this comes down to trust. And trust is one of those things that can take ages to build up, but seconds to lose. Particularly, I've seen across most of the social media platforms this morning, a lot of the groups and stuff, many people are actively just deleting the app because this has made them lose absolute confidence in it being of any form effective. And I'll be honest, I'm one of them. So I had the app up until this morning. You mentioned earlier there was a slight other issue I found, that when you move location, you can't change, from what I can find out, the element of where you're being located. So I'm currently in London at the moment, and I can't check it in London without deleting the whole thing anyway.
If the risk level changes, you won't receive notification of the risk level change, which is quite important. It's not necessarily a deal breaker, like the contact tracing not incorrectly, but
it's an annoyance because it gives you less information about your potential risk. So if I came to this area and realized it was a higher risk area, would that help me make a better decision about whether I should be traveling to that particular place or not? I don't know, because I don't have that information. I've only got it based on my home location. And you mentioned it earlier, what if your home and your work location are in 2 different risk areas, which is clearly possible because most people do not work in the same postcode as where they live. The postcodes change, obviously. So bit of an issue, but definitely the fact it doesn't link up with the centralised test and trace systems, as far as we can tell in terms of the NHS testing, it just raises the question, what's the app for then? And lots of people are really concerned that this is just a way of collecting our private data and handing it over to private companies, because that's what most people are assuming is now the function of this.
And it's not even that. it can't even do that. It's a real shame. And I was talking to my parents on the phone last night, and they downloaded this app before I had, on day one, and they were quite enthusiastic about using the app. But they'll see this news, because I'm sure it'll be, unless it's quashed quickly and found to be false, it'll be on mainstream media, and their faith in the app will be shaken. But they were about to become really good advocates of people downloading it. I'm sure they would have got all their friends to do it as well. Real shame. But there's a few other things to talk about, I guess, around the app. And I think it raises some interesting questions in all sorts of dimensions, really. So Gandhi, do you think people will download this app now? What's your opinion?
I think that it clearly needs to be a clarification as to what's broken today. Absolutely, that needs to happen, because if it doesn't integrate with the NHS database that we have in terms of results and stuff, as you said, it raises real question marks about the functionality. Let's assume that this story is false and that actually it does do what it's meant to do and it works. Okay, so we're going to take that assumption from this point onwards. Well, yeah, I had it downloaded. I was happy to use it. It does have a couple of idiosyncrasies as well that you do need to be aware of. So number one, because it uses Bluetooth searching elements, actually it can drain through your battery fairly quickly. So it's important to recognize that you may have to potentially, in particular if you're quite mobile, have a charger or something like that with you, because your battery level will drop relatively quickly whilst the app is on. And then there's the added complexity for those of us working in the healthcare system, because actually there may be times where it's completely sensible and appropriate for you to turn the app off. And you showed us that functionality with the toggle on off Bluetooth element, didn't you? And the fact it has a reminder. I mean, how have you found that? Because it's been an interesting question, hasn't it?
Yeah, so I think the question really is, so should GPs use it? Should GPs use it in surgery? Because we will be in contact with a high number of people, as you might be in a bar or a restaurant, I guess.
Yeah.
But for a lot of that time, we should be wearing personal protective equipment, which should reduce our risk, because the general expectation is that we will potentially have exposures to COVID-19. That's why we're wearing the PPE. And we have not previously been instructed, despite being in those high risk environments, to self-isolate when we're asymptomatic. And the problem is that you might use the app, have a contact, and be asked to self-isolate based on the app, and then it's difficult to know what to do. One way to avoid that dilemma is to deactivate the app whilst you're consulting, or keep your phone somewhere different, while you're consulting. But a lot of people find our phones useful, don't we? And we need to be contacted, for our work. So that might be challenging. So I think I'll be using the app, but I think I will not be activating it, potentially while I'm in surgery, because and I might actually just not use it while I am at work, considering that environment to be different and a place where other safeguards and safety nets involved. So I think that's how I'll be behaving with regards to the app. Gandhi, how about you?
Well, so there's a couple of added elements to this as well. So important to remember. So number one is the fact that it does allow you to switch it off when you are in a place where you are potentially at more risk. And what I do like about the app is that it's got set time frames that you can do that. So it reminds you that it is actually off. So I do like the fact they've thought ahead and realised that that's a key functionality. An interesting one that I don't think many people have thought about. So actually, NHS England have said that when you're at work, if you're in PPE, you switch it off, because otherwise we're going to have loads of the healthcare workforce going off because of contacts, because they may have come in contact with somebody else and that person may have come in contact. It's going to happen if you don't switch it off. But an interesting part, I don't think people have quite figured out completely yet. That's great for patient-facing staff. So like, for example, me and you, because we see patients face-to-face in our clinics. But what about our admin staff who don't actually have any face-to-face contacts? Should they still be leaving the app on or off when they're at workplace? Because theoretically, if they have no patient-facing elements, they should have no risk of catching COVID whilst they're at work. So if they were to then be contacted because of somebody they've come in contact with, is that actually more relevant than, for example, me and you, where we will be PPE'd up and fully suited and booted kind of thing. So that's one thing to consider. Actually, should your non-patient facing staff potentially still be having it on at work?
I'm going to say, just to be controversial here, there's a big business continuity issue, isn't there? Here, because I'm just thinking about the geography of our internal office and where the admin staff sit, and particularly their behaviours around lunchtime, and taking their phones to the room. And actually, if one of them is asked to, receives a positive code, then probably all of them would be asked to self-isolate. I think there's a very high chance that all of them would be simultaneously asked to self-isolate. And there's a big business continuity issue, but a continuity of actually GP surgeries being able to actually provide care, which is absolutely essential, particularly in time of pandemic, but is essential all the time. So, I think it's tempting to say, well, it's an office environment, the same rules as all other office environments should apply. But also it's a critical part of health infrastructure. And there is a real risk that it just gets torpedoed. And also, what is the evidence base behind the apps? It's a nice to have, but if you're going to consider shutting down a whole GP surgery and potentially multiple GP surgeries because of a policy position about whether admin staff use these apps in surgery, I think you need to be more sure about what it means to have a positive contact on the app. And I'm not sure that the evidence base is there to justify potentially closing down swathes of the NHS. So yeah, controversial. And actually, we'll probably have a discussion in practice about the use of the app and come up with what we feel is a defensible position. What about you, Gandhi? If I put you on the spot and said, would you encourage your admin staff to use it? Yes or no? Would you actively discourage them? Yes or no?
So again, based on the premise that the earlier stuff about the controversy is sorted and not an issue, I would be keen to use it because I think it does have potential benefits. I think I would switch it off at work. And a bit of a shout out to Jez McCall, who's already commented on the YouTube channel about this, that there are other mechanisms you can use to help automate that process. So that what you can do is have apps that automatically switch off your Bluetooth when based on your geolocation data. So, these are, particularly Android has loads of these kind of apps. But when you get to a particular postcode location, so you can stick in specifically your work one, it will automatically switch off your Bluetooth. And therefore, you don't have to worry about remembering to switch it on and off when you go and leave work, which is, I think, potentially a really good option. I think the inbuilt mechanism in the app is a good way of trying to do it generally, but obviously that mechanism means that you can target it to particular locations that you are or should be safe based on the principles and processes already put in place.
Really like that. That's a great suggestion. Love it. You've got to remember to switch it back on again. I like that it doesn't switch it back on automatically. I think that's really good, because there's a danger that it comes on automatically when it shouldn't. But you're going to have to remember to A, switch it off, and B, switch it on again. So yeah, that's really good.
And clearly with that, I mean, Jez again mentions it'd be really nice if they made the API available, that therefore people could do that automatically with the geolocation elements and things. But okay, no, that may not happen. We'll see.
Again, Gandhi, do these apps work?
As in the ones that switch off your Bluetooth and stuff?
No. Contact tracing apps. Are we? I'd had a little look around the internet earlier to just try and establish, okay, under what circumstances do people feel these apps would work? Do they work? I think, and actually, so that not surprisingly, there's not a great deal of evidence out there as to whether they work or not. I think people are working from first principles, and that these are, it's logical to support contact tracing in this way. So a big thing. So I was looking at what proportion of the population would need to be covered for the app to work, and I got figures in the region of 50 to 60% based on a number of different sources, and these were mainly news media articles, not journal articles.
Okay.
And have any countries achieved 50 or 60%? The answer is no. The closest people to that number are Iceland, who achieved 38%, and also Singapore, who achieved 37%. And they were a very early adopter of apps, and they're a little bit more authoritarian, some might say, in terms of their culture and their willingness to follow rules. Again, you want to make national stereotypes and so forth, but that's what people say. And they've got the highest adoption. So there's a question mark as to whether we will be able to achieve sufficient coverage. Some might argue that, and actually I've heard people on the radio supporting the app being asked this question, saying, well, every little bit counts. And if we're able to save some lives and reduce some infections through the use of the app, then that's a positive, and we're bound to do that. And I sort of agree with that, really. But in terms of having a big impact, it's debated whether we'll get there.
Well, that's the key thing, isn't it? You need adoption across the population for it to work. You know, if only 10% of the population uses it, then it's not going to be fully effective and have the impact that you need, because then you've still got 90% of the population not covered. It's also important to remember that there's always going to be a percentage of the population where you are not covered. As we mentioned earlier, you need to have a phone that's got enough of the kit inside to let you do it. And then you also have the digital literacy in order to use it, and the awareness to use it, and that kind of stuff as well. So it's just, in order for it to be effective, it needs uptake across the country, and that's the part we don't have any information or evidence about. Partly because it's the first time it's being done, so fair enough. There may not be evidence because it takes time to generate evidence. We've seen that throughout the entire pandemic. Many people talk about what's the evidence. Well, the reality is we don't have any because it's not been done before. But yeah, uptake's a key issue, isn't it?
Yeah, the higher the uptake, the more effective, I think. And also, I'm a little bit skeptical about some of these figures, because it's what are they comparing it to? Is this an environment where there isn't a conventional, effective track and trace program, that's human-led, telephone-led, running in parallel? Is this having a complete alternative to that, or is it where it supplements that? So it's difficult. I think really countries need to get their apps in place, push them, get the uptake as high as possible, get them to do what good they are able to do, and then we'll learn all sorts of really exciting things in the post-mortem of this event. So I think it'll be really interesting to see that data out the other end. Gandhi, I've got another question for you. So, so if you were a bar or a restaurant or a hairdresser's, then you will be required to display one of these QR codes that people can scan as they arrive. It's optional for the people to scan, but you would be required to show one. There's no contractual obligation for a GP surgery to show one of these QR codes, but you could. I'll just bring it on the screen, actually. For those people who want to create one of these codes, there's a link. We'll put it in the show notes, but you can just go in and you can create a code for your venue. I won't register just at the moment for that. Should GP surgeries create these codes? Will you create one of these codes for your GP surgery?
So we've got one.
We have it already.
Yeah, so in our area. I must admit, I can't remember if we've got one up in the patient area. I'll probably need to check that on Monday when I get back to work and stuff. But yeah, we have one. And I think one of the other things that's been discussed is whether or not this is relevant for obviously our upcoming and continuing flu clinic that many practices are currently doing. Because should patients and people attending be scanning themselves in when they're attending flu clinics, because that's when we're going to see a lot of throughput of patients going through the practice. Now, you'd kind of hope that a lot of the practices have got their systems in place for social distancing, for trying to reduce contact and that kind of stuff. But is that relevant? There's going to be times where there's going to be congestion, shall we say? And I would argue that a lot of places probably won't have their systems in as such that you get through the entire process from walking in and walking out the building in 15 minutes. It's quite tight, and that's the time frame that obviously we're being asked to monitor on in terms of location and stuff. Because you physically probably be in the building for that length of time. Not that it takes 15 minutes, obviously, to have your flu jab. But that's an interesting one that's currently going around. Again, a lot of the GP forums and stuff. Do you need to be using the QR code for your patients when they come for their flu clinic?
Yeah, I think what would help us make that decision is a little bit more information about what constitutes a contact between phones,
Mm.
because what is defined as close contact, unless it's changed, I believe it was less than 2 meters for more than 15 minutes. That's quite clearly defined. And I've read in some places that based on strength of Bluetooth signal, it's possible to make some deduct some idea of the proximity of devices, and obviously devices can know how long they've been near each other
Yeah.
for. But I've not seen anything that tells me whether the phone makes where it draws the line in terms of when it logs a contact, whether it has to meet those criteria or whether it's some lesser criteria that it meets, because that information would actually help you risk assess your flu clinic. If you're confident that people are not going to be there for more than 10 minutes, 5 minutes, if they're arising in slots, you're confident there's space, then maybe it's lower risk. But I've got quite a clear position on this actually, because I think this is actually structured quite well. The government makes it so it's up to the patient whether they scan the QR code at the end of the day, when they come to the venue. This is about patients making decisions about whether they want information about, their risk level in any particular environment. Certainly in bars and restaurants, they should, but they don't have to. They can make a decision, and they're the people who bear the risk of receiving an erroneous notification. So I think you provide the code both at your flu clinics and at your GP surgery in general. And obviously you're not going to police it. You don't have time. The staff don't have time to do that. But it allows patients to decide whether or not they want to do that. So I think that's my position.
Yeah, sounds sensible. Definitely agree with that.
Cool. So we've talked about some of the problems here, the main ones around the postcode, and certainly around it seeming that it is not compatible with NHS positive tests, which is of course a biggie. We've talked a little bit about the delay, and that the UK government potentially went down the wrong path in terms of developing its own app. And we've talked about that in the past as well. I think they were a bit too ambitious, really. They were hoping to collect additional data about GPS locations and additional postcode data. The logic being that actually having that data would be really, really, really useful to help coordinate the NHS response to COVID-19. And it probably would have been, but they ran into problems with battery life and privacy concerns, and also that I don't think the whole thing worked very well. So that brings us to our thoughts on it all, or reflections section. Any more philosophical or wider ranging thoughts, Gandhi, about this whole thing?
Well, so we've got the architecture for this to work, and for this to potentially work quite effectively. We've seen other countries that have implemented what looks like a more effective response than currently what the UK has done, and that may be because of the delay that we've had with the process that the UK has gone down. I think in principle it works really well, and it has the potential to, like you say, save lives, because if we can get that information, get it out quicker, more effectively, reduce the contacts, that's what we're trying to do. We're coming up to flu season. A lot of people are really worried about what's going to happen this winter. Winter has always been a challenging time for the NHS anyway. When you compound that with a flu season and a COVID season that has the potentials for massively overwhelming the healthcare service, quite rightly, many are genuinely worried about how this is going to work. So anything that can help with that, I think, is a really positive thing, and we should be exploring. But they need to fix it, don't they? Absolutely. They need this to be working the way it should be working, not the way that seems to just do nothing, to be honest.
I agree. I think I'm going to be a little bit more optimistic here. So, right, there's been a missed opportunity. It could have been out earlier, and I think it is actually a really useful measure. But it's here now. Granted, it doesn't work. It would seem that's with NHS tests, that's a huge problem. They need to fix it. It's very unfortunate that that's going to be the biggest news story about it only a few days in, when they're trying to drive people to download. So there's lots of there's lots of issues, but it's here, it's built. I think it will help as part of the whole range of measures that the government and the NHS are putting in place. And I think it's a really good model for how we deal with these sorts of things in the future. And also, the game's not over. This is going to be around for a good few more months, so it can still have a really good impact. And actually, I think the concept of an app that the public that can download that has some technical functionality to protect them, and also is a good single point of getting reliable location-specific information to the patient about what is happening around coronavirus, and allows the government to send a notification to them because you activate notifications. I think that's a really, really good tool for the future. I've been sending people text messages with links to this part of the government website and that part of the government website. But if from the start, but it's there now, if there's an app that the public can just go to and easily, simply get the relevant information about what is happening, I think that's only a good thing. And I think it's something that we'll see our government, other governments doing in response to public health problems in the future, natural disasters, in the future. Just quickly get the app out so that you can coordinate your public's response. I think we might see that as part of, just general government toolkit in the future. And it's great that has come into being, really. The other thing I would say, I'd be interested to know what you think about this, Gandhi. I think there's been an entrant. I think how the data has been handled, and that we're maybe getting people used to having a device on their phone that they actually use in a very real way to monitor and manage their health and their risk of disease, and that many people will download and use the app, and that there is element of trusting some data about themselves to Google, Apple, and that they've found a way of doing that in a dispersed way that respects privacy. I think all of those changes and innovations and changes in attitude are really, really good. So I wonder if it's reduced that barrier for people perhaps using more health apps in the future, and more innovative health apps that handle privacy in an innovative way coming along. Maybe I'm being optimistic, but getting my mum and dad to download an app about their health, that was a big achievement. And they might do more similar things in the future. So discuss. What do you think?
Like you said, that they set up the architecture for this being used in other kind of situations. I mean, go back a couple of years, we had a massive measles outbreak across the country, that had real impact. Now, yes, it wasn't COVID. It wasn't as far reaching as the impact of COVID has had. But imagine if you could, quickly switch on a mechanism that allows people to track who they may be in contact with and rapidly prevent the spread of things like measles, mumps, rubella, which we know we were seeing an increased surgence of, which is one of the reasons why, despite the pandemic, everyone was told still get your vaccinations, because what we don't want is in a year or two's time to have another pandemic of another health issue like measles, mumps, rubella, and various other health conditions as well. So, the architecture is there for this to work, and potentially work for either that or, God forbid, another pandemic like COVID, So
absolutely. Yeah. Or an earthquake or something, just getting an app out there to help with the public's response to it and get key information out. I think it's really exciting. So Gandhi, bottom line, we may know the answer to this already now, but so will you use it? Will you recommend it?
So if they fix the problem, yes. If they don't fix the problem, that with this, the controversy and the issue, the fact it doesn't link with the NHS data, no, I don't have the trust or the reason to do so, to be honest, personally.
I'm going to say I'm going to recommend it to people. I'm going to say that my expectation is that they will fix this problem. I think they just have to. So I will use it. I will switch it off when I'm in contact with patients in the surgery. I will recommend it to other people because I think it's going to be a useful app when they fix the obvious flaw. So yeah, I think it's really good. I think it's really positive. Should have been here a long time ago, but
definitely cool. So we've talked about the app and stuff. I guess one of the other things we did want to mention, because we've talked about digital literacy, we've talked about digital use in primary care and all that kind of stuff, and a lot of that feeds into our upcoming conference, so our virtual digital primary care conference that is this Wednesday, so 5 days time, where myself and Andy are going to be coordinating and leading and facilitating effectively the UK's first virtual digital primary care conference. And we've got
Share the screen, Gandhi. Share the screen. We'll put it on the screen.
Right, let's go for it. So we've got some absolutely amazing content coming up for this.
Click the link.
For simply attending, you will get access to Dr. Nikki Kanani, Head of Primary Care for NHS England, talking about the future of general practice, and that's going to be our ending keynote. Dr. Minal Bakai, who's Deputy Lead for Digital First Primary Care in the UK, talking about what's been happening with Digital First Primary Care, which I know many practices, many patients have been engaging with, but also the challenges, the pros, all this element of stuff that's happening. And there's going to be a roundtable discussion with her, the BMA, and various providers of digital first systems. We've also got NHSX having streams throughout the conference talking about how this whole concept of you can use digital better for your patient population. So in terms of, those patients that struggle to use digital aspects and digital literacy, but also in terms of care home residents, in terms of shared care records and GP appointment data, as well as other things as well. So there's some really good content coming from them. On top of that, we've got our various sponsors helping out with some of the products they've got for primary care itself and how that's going to work. And actually, a lot of this relates to secondary care as well, how we can have better integration and data sharing to try and make the whole NHS work more effectively. We've got a roundtable discussion being chaired by Simon Gregory from Health Education England, talking about the challenges that we've had with education over the COVID period and what this means. There's loads of issues in terms of how it works for medical students, GP trainees, other primary care members of the team and stuff. Education has taken a bit of an interesting twist with all of this and how that's going to look. And there's more. We're going to be releasing the Redmore Health Digital Journey Planner. So this is basically a mechanism to try and help practices, networks understand where they are in the concept of their digital journey that many of us have been taking and running with for the past few months. But how is that going to work with patients? So one of the biggest challenges with digital primary care is, what do you do for the patients that just don't have access, that, those patients that don't have the ability to engage, all that kind of stuff? Well, we're hoping that this digital journey plan will help you to benchmark where you are and have the tools and mechanisms to help you understand where you can move forward, both in supporting your practices, but definitely and absolutely supporting your patients as well. And to chuck some extra stuff in, we're going to have some fun and games throughout the conference. And if you do attend, you'll get access to recordings of all the events afterwards. And if you can't attend, because the reality is some of us are busy and working, you will still get access to that after the event just by signing up and things. So basically, we think you should join us because we're going to have an absolute blast, aren't we, Andy?
We are. It's going to be fantastic. The platform is really, really good. The Hop-In platform recreates the experience of going to a physical conference, which I'm sure we've all been missing and craving perhaps a little bit. Recreates that quite well, actually, in the virtual environment. This is much more than a series of Teams meetings or Zooms meetings, much more interactive. And we've got some videos, I'm sure we'll put them in the show notes, about the platform and about the conference, so you can take a look. And what I would say is, this is a digital conference. This is different. So if you're thinking, oh, it's just a few days to go, I'm not quite sure whether I can be available, well, you still sign up, because you'll be able to maybe attend a few of the sessions. But even if you're not able to attend any of the sessions on the day, all of the recordings of this really, really fantastic content is going to be available within a few days of the close of the conference. Gandhi and I are going to be there editing through it all and putting it out there on a video platform. You do need to have bought a ticket for the conference to see that material. There's a lot of free content on EGP Learning, but unfortunately, to respect those who have attended the conference, that will be restricted to those people who have purchased a ticket. So yeah, go ahead. So look out for the links. It's all over Gandhi's social media, EGP Learning. Click the link to the ticket, to the Hop-In platform. Take a look. If you like what you see, then just sign up. And I say nominal fee there, because there have been costs associated with creating and running the conference. But it should be fantastic. Just sign up, come along. It's going to be fun.
Yeah. One of the other things that we've learned loads of lessons from doing a couple of these recently. We've got excellent support to try and help you if you're not sure how to use the platform. So we'll be having WhatsApp groups to support people with the onboarding, so it's a lot easier and stuff. We've got loads of content to hopefully help you with that. So definitely recommend signing up. I think people are going to have an amazing time, and this is going to be something that you will not want to miss. Absolutely.
Great. So I guess that probably brings us to the agenda of the end of at least our planned content for this morning. Anything else to add before we go, Gandhi?
No, I think that's everything. So hopefully we'll see many of you at our Digital Primary Care Conference on Wednesday. We're back in a couple of weeks, and we've got loads of other stuff coming through for you in the coming weeks. And feel free to check out the EGP Learning YouTube channel for loads of that kind of content we've been having over the past couple of days in particular. And I guess, as always, EGP Learning is here to help save you and your patients time by taking Andy in primary care and learning. And we will catch you in the next episode, won't we, Andy?
We will. Bye, everyone. Ta-ra.